So starting with thinking about why take a person-centred approach, I think sort of the key message from this research is that properties don't experience fuel poverty, it's people that do. And vulnerability to fuel poverty is only partially about the property that people live in. And we can learn more about fuel poverty if we think about it more in terms of energy vulnerability of the individual and the household. People experience fuel poverty in different ways. So the initial symptoms of fuel poverty can be quite wide-ranging, and it's not just high energy bills, it can be about rationing fuel and ways to cope with being cold. And the detriments that people experience as a result of that are also different for different people. It could be poor physical health, it could be financial strain, it could be family relationships. But those detriments have a wider negative impact than just that household. It's going to affect other stakeholders that they interact with, their doctors, their landlords, their employers. So a person-centred approach helps in two ways. Firstly, to identify interventions where they might be most beneficial, take into account what individuals are vulnerable to and what they're suffering from as a result of fuel poverty. And secondly, to look at that wider impact of how those stakeholders are affected, and how they could potentially help or could benefit themselves from helping those individuals. So the idea is that if we can better target fuel poverty interventions and what people are suffering with as a result of fuel poverty, you can deliver better outcomes for those households and individuals. And then the aim is that will have a positive wider impact on those other stakeholders, so deliver co-benefits to them. And that's kind of the foundation for the research, that a person-centred approach can better target vulnerable individuals and households, promoting a worst-first approach, but that also it supports a more holistic approach based on the knock-on impacts on that wider group of stakeholders. So the persona approach, these are archetypal users. They embody real users, but they're not individual case studies. They're based on a broader evidence based, but they're easy to assimilate in their interpersonal form. So as I said, they're based on wider evidence from this literature review, which is, they're only good as the evidence they're based on. So that's why we started with the literature review. But they help summarise that in a way that we can kind of present and understand. So it helps us focus on who we're really looking at when it comes to fuel poverty, so we know that, and then we can have a kind of user-centred design that we have a clear focus on who you're trying to help. And I think most importantly in this case, when we're trying to engage a wider group of stakeholders, it presents that evidence in a really personal and believable way that engages the empathy and interest from stakeholders. I think we can't take in a broad amount of data, it's difficult to absorb that, and our brains respond better to stories that engage our emotions. So the aim is to have that sort of engaging approach, but it's based on the evidence, it's not anecdotal. So we developed 6 personas, which between them cover all the kind of vulnerable characteristics and the symptoms and detriments that we identified in the fuel poverty literature review. So the first one is an older home, a couple in worsening health and mobility. The second one is an older single person in rented accommodation with worsening health. And the third person is a single parent in rented accommodation, a large family in rented accommodation, a family with a disabled adult or child in a home that they own with a mortgage, and a young single person in rented accommodation. So those 2 personas hopefully have given you some indication of who might be impacted by fuel poverty and how that kind of differs, and that detriments don't just impact individuals but will have a wider impact on the stakeholders that they engage with. So again, the model that you can now sort of see is demonstrated through the causal chain that's in the evidence, shows that those positive outcomes lead to a positive impact on a wider group of stakeholders. Just to quickly summarise, I mentioned some of them. So obviously health service, fewer use of their services and financial impact on them. Employers in the local economy, so there's also evidence that people have fewer sick days following energy efficiency works. There's a broader economy benefit from having jobs in the green sector and that supply chain, and potential economic effect through the rebound effect to higher spending. Landlords, I mentioned, have a lower tenancy turnover and vacancy, but also have increased property value if they upgrade their homes. Energy suppliers have that reduced arrears and debt collection costs. And then the energy system, the district network operators more broadly, There's research particularly from the US, that shows the benefit to them from actually having lower energy demand. It means the demand during peak times is reduced, so that they don't have to invest as much in the reserve systems to handle peak loads, and they just generally have lower need for lower generation costs. They can defer their distribution upgrade and reduce line losses. So some kind of technical ways in which the energy system benefits from having lower demand. So just quickly to conclude, so this person-centered approach we think could be more effective by targeting those most in need according to the symptoms and the detriments that they experience. And hopefully the personas developed through this help convey that evidence. And it highlights the wider impacts, and then also identifies those stakeholders that are affected. And the potential benefits from working in partnership with those stakeholders is they can help identify those target groups who are displaying those symptoms, either through their frontline staff or other data that they hold. And then those mutual co-benefits might financially benefit those stakeholders, so that might give them the incentive to co-invest in fuel poverty initiatives. So we think that a person-centered approach is therefore compatible with this kind of holistic partnership approach.